So our
Um,
first presentation is from the Public Health Problem-Solving Paradigm and Interprofessional Team Training, FIT.
In our case, we will present an interprofessional approach to managing type 1 diabetes in pregnancy through a complex patient case utilizing the public health paradigm. The case was put together by Allison Key, Emma Mather, Erin Mazaruki, and Megan McAuliffe as a collaboration between students from the College of Medicine, the undergraduate medical biology program, and the undergraduate public health program. Our patient, Amy Jensen, is a 34-year-old female. She was diagnosed with type 1 diabetes at 11 years old and is currently 4 months pregnant. She is married to a supportive partner and serves as primary caretaker to their 3-year-old daughter, as well as her wheelchair-dependent mother. Recently, her husband changed jobs, causing the family to temporarily lose access to health insurance. She is currently applying for Maine Care. Currently, the family is under financial strain as her husband's new job has higher potential for earning, but current income is less during his training than they previously relied on. She is working as a waitress to help bridge the gap. The financial strain and the stress of working while also serving as a caretaker has limited their access to healthy foods, and now the family is primarily consuming frozen or packaged foods. Amy has a strong support system of family, friends, and a supportive workplace. Risk factors affecting Amy are shown on this slide. At this point, the biggest concern with her health is the lack of prenatal care. Some protective factors in Amy's case include her support system, living in a safe and walkable community, and her eligibility for programs like Maine Care and SNAP. This diagram shows how those factors interconnect to affect Amy Jensen. Both protective factors and risk factors affect each other and her in unique ways. For Amy, accessing SNAP or WIC to improve access to food will be beneficial for her pregnancy, her diabetes, and her overall health. She is eligible for SNAP due to her financial status and as a caretaker for her mother. She is also eligible for WIC through her pregnancy. Amy is being provided information on utilizing MedAccess to access her insulin. This program is available for anyone who needs it. The Insulin Safety Net program will also help Amy by capping her monthly insulin costs at about $35. While she is on Maine Care, her insulin costs are covered, but should she receive insurance through her husband again, she will be paying less in medications. Amy will also be able to access free transportation to her doctor's appointments through Maine Care, a service that will help to support her ability to receive prenatal care.
all right. Well, I guess I'm the official facilitator of this session, and we have about 3 minutes, and I'm kind of curious. Well, first of all, does anyone have any questions for the group about the work that they did? Do we actually have any group members here? Who is here? Can you unmute yourself if you're a group member and just kind of claim your presentation? Anybody?
I think all 4 of us are here.
Excellent. Hi. So, okay, well, if no one has a question, I have a question for you. You came from a couple of different perspectives, social work, public health. How do you each see yourselves or your profession helping this particular individual with all those interconnected factors that you talked about? And I think, Erin, you're on my screen, so maybe you want to start.
I'm a public health major, so I was like looking at it from that standpoint. So I was like kind of like looking at like finding programs for her like SNAP and WIC. And then we also just like obviously wanted to get her help for like her pregnancy and stuff. So then we looked at like things that she could do for her insurance. So we kind of like I think we started with like finding like smaller programs and then like broadened it from there.
That's great. How about someone from a different profession? How would your profession help this specific individual?
Coming from the College of Osteopathic Medicine, through the PHIT program, we had the opportunity to meet with one of the social workers that's embedded into a clinics, outpatient clinics in Maine, through I think it's through Maine Med. And so I think making sure to refer into those services as her like physician would be very important, just because there are a lot of outside factors that are kind of inhibiting her ability to access care.
Absolutely. And I'm glad you also brought up the social work perspective. I don't know if the social work student is on this, because I'm guessing, and this might be a deeper question, that providing, and I loved your framework of all the interconnected, resources for her, but kind of convincing her to access these or helping her see these. I don't know, the social work student, did you talk a little bit about kind of how you would approach this individual with, to help her kind of feel good about accessing these or feel comfortable with that?
I don't know if we actually have someone that is like
Oh.
social work. It says that it was me, but I think that it was wrong.
So this is the public health problem solving paradigm and interprofessional team training fit team 7. Welcome team 7. And we're going to hear their video about a team approach to improving mental and physical health, a patient-centered framework.
So we have our patient introduction here. Our patient's name is Aura Lewis, 35-year-old Caucasian, they, them pronouns. The patient is on medications, which are bupropion, as well as Botox injections. And past medical history, the patient had 2 concussions, 2013 and 2023, broken wrist at the age of 5. Some of the patient's comorbidities include hypertension, obesity, depression, dystonia, diabetes, and alcohol use disorder. The patient's allergies are shellfish and latex. So some of the patient goals we have for them are reduce the frequency and severity of dystonic episodes, as well as improving functional ability. We would also like to improve their mental health and well-being and medication education. We would also like to achieve healthy weight and blood pressure. And lastly, we would like to achieve and maintain sobriety for this patient. So those are some of the goals we've set for this patient.
This is a quick patient-centered framework that we created for our patient, Aura Lewis. Here we've included some pertinent co-occurring conditions, such as their new and untreated diagnosis of stage 1 hypertension and obesity. We've also included an older diagnosis of dystonia, as this is one of their diagnoses that we'd like to address with this patient, as to try to find a more accessible and efficacious treatment plan. We've also included here their co-occurring and anxiety and depression, as this has greatly impacted this patient's health outcomes. Some individual factors that we felt were really important for this patient that the patient has made clear to us that they would like to address is their social independent alcohol use. Something that we'd like to address with this patient is potentially finding community that doesn't revolve around alcohol and events that maybe don't have alcohol as the center point. On a different note, we also would like to address with this patient how their dystonia has been affecting their sexual activity as well as their ability to do art, because both of these things are greatly impacting their mental health. We would also like to address with this patient the accessibility of finding groceries, as well as spending time to move their body and exercise in a way that feels good to the patient. These are both things that we'd like to make a plan with the patient and work with the patient to find solutions that feel best for them. Lastly, we felt in this section that it was important to bring up that both of their parents struggled with alcohol use disorder as well, and that they separated, and recently Aura separated from their partner, and this has presented many difficulties as well as limiting their transportation.
There are 3 channels of interventions that we hope to explore: community, access to care, and identifying next steps for treatments. Community starts broad at the social determinants of health by identifying community and social engagement that does not center around alcohol and helps connect our patient to important parts of their identity. Such organizations include the ECC, the Equality Community Center, Kindling Collective, and Maine Transnet. The access to care is currently limited by the patient's financial situation. By identifying the patient's eligibility for Maine care can potentially help them have greater success and access to needed medications and treatments. We can also identify the need for a case manager or social worker that can help the patient apply for Medicare if eligible, and help with the case management for this patient due to all of their comorbidities and currently untreated diagnoses. Developing this support system is crucial due to their comorbidities, and it will help them access treatment and go through the process of treatment. Identifying a physical therapy practice that does either pro bono or low barrier care to help the patient address their dystonia, as well as engage the patient in physical activity to start to address their new obesity and hypertension diagnosis. We want to utilize mainqueerhealth.org, as this could potentially explore OMM at the free clinic on UNE's campus in Biddeford. The next steps to treatment include discussing with the patient whether they would like to be sober or learn more about harm reduction to address their alcohol use disorder. This includes referring the patient to a therapist or a counselor that specializes in queer identities and recovery or harm reduction work, depending on what feels most important to the patient. This can also be done utilizing mainqueerhealth.org. Additionally, we want to identify food banks near the patient to address the food insecurity that the patient experiences. Such food banks and resources include Wayside or Preble Street.
I know we don't have very much time for questions, but I feel like that last slide that we wasn't spoken about would kind of addressed Jen's question about process and about how that interprofessional collaboration happens. So would somebody mind from that team just speaking, because I know you've got an osteopathic medicine, a nursing, and public health. Can you talk about kind of how that collaboration went in this project?
Yeah, I can speak to that a little bit. I don't know, Leah, if you want to jump in. We all worked together mostly online. We touched base we're face to face over Zoom. And then we kind of jumped into the project using tools like Google Docs and a lot of email. But having that initial Zoom meeting, I think was really helpful just to get to know each other a little bit face to face. And then we also had a Zoom meeting halfway through as kind of a check-in to see how things were going. Aaliyah, I don't know if you wanted to add anything to that.
No, I think you covered most of it, but yeah, we kind of checked in with each other and just worked together. I think all of us had different experiences and a different outlook on the patient, because I think we're all doing different programs, so I think that was really helpful for us.
That's great. Thank you. Chris, are we on schedule, or can we hear from Sadie? I don't know if Sadie's here.
I think I'd love to hear from Sadie. I'm going to put up the new slide. We have to wait until the audiovisual team joins us before we start the next one. So let's keep the conversation going. I'll just have the slide up.
Excellent. Sadie, are you here?
I don't know that they're here today.
Excellent. Well, not excellent, but that's totally cool. One interesting thing, Gail and Aaliyah, you talked about is how you met online, through these kind of face-to-face virtual meetings. And I think this new space of Zoom, I guess it's not that new anymore, really does afford us a lot of opportunities for still collaborating, but not being physically present together. And it sounds like this team was able to use that, especially given the fact that you were all in different programs and you were all in different, physical locations. So I think that's such a wonderful development for collaboration is technology, and for having this space. Oh, I'll queue up this one because this is very near and dear to my heart, because this is an undergraduate group who were interested in looking at community schools, which is inherently an interprofessional or lots of different professionals help working together to help not just educate students, but strengthen communities. So I will let it go.
We're here to share our findings on the research we have done surrounding the interprofessional relationships within community schools. Early in the semester, we came together as a group of education, special education, occupational therapy, social work, and art psychology majors to dive deeper into what a community school was. Despite our differing career paths, we shared a common desire to help those around us and immerse ourselves in doing so. We were all brought onto the team and guided by Dr. Lane Clark, the academic director of the School of Education, as well as senior teaching professor Dr. Carol Marcotti. Phase 1 consisted of our initial research exploring the question, what is a community school? We later broke into smaller groups and were able to visit 2 out of the 4 community schools currently existing in Maine. Others were given the opportunity to interview professionals, including Ann Hanna of the Maine Department of Education. Community schools are founded on 7 principles. These principles are designed to guide schools in serving the community and their students in a whole person approach. These schools combine learning, physical and mental health, along with support for the essential daily needs in order to provide opportunities and support to everyone in the area.
There are 4 pillars that guide community schools. Let's dive into the first one. Pillar 1 focuses on expanding learning time outside of the classroom. They have before, after school, and summer programs where tutoring and multi-tiered support systems are set in place. The goal of all these programs are to create new experiences for children that they would not otherwise have.
The second pillar is integrated student supports. These include a variety of supports aimed at encouraging learning along with promoting mental and physical health. Examples include athletics, clubs, and programs for food, clothing, and language. A variety of interprofessional staff, including pediatricians, dentists, counselors, and social workers, also work to support the students.
Pillar 3 focuses on family and community engagement through a variety of programs and services available to students in the surrounding communities. Multi-purpose rooms can be utilized for adult education and outreach events, in addition to their traditional academic uses. These resources are designed to benefit everyone within the community.
Pillar 4 focuses on collaborative leadership. The main theme is an idea called shared leadership that requires members of a team to ask for help and make decisions to build school and community programs based on student interests and needs. The 2 key players are the community school coordinator and the community coordinator, who work side by side to help meet identified needs by connecting everyone in one place.
As a group, we came together and explored the question of how can the University of New England students help support community schools. We were inspired and found many ways we could connect with local community schools. University of New England has many clubs and organizations that could provide education and support to students and families. In the fall next year, we hope to create a club to bridge the gap between UNE and the schools around us. We both have many resources and want to harness the opportunities we're afforded.
So proud. So I know I was deeply involved in this project, but I would love to hear somebody else in the audience who might have a question for this group that just got together. Mike Sheldon, you can start.
Yeah, good afternoon, everybody. My name's Mike. I work in the provost office. I'm curious because you all said, you know, you're all connected in terms of interest in this particular area. If you're going to now pursue, you know, leaving UNE and going on to your careers, what would influence your decision to teach in a community school versus another type of school? Is there something you learned that would say, oh my gosh, I would definitely go in this direction? Or I don't know, you know, there's some pros and cons here. So I'm just kind of curious of how this impacted you personally.
Kelly, I'll let you answer that one.
So I am a social work major, second year student here at UNE. So when I went to visit Talbot, I absolutely fell in love with the school, actually. The community that they had, everybody was so interested in supporting the students, and that aspect of it was just so touching. So my goal for once I get my master's in social work was to go be a clinical counselor in an elementary school. So seeing the way Talbot is run and the different players that all work together was definitely like something that made me more interested in going towards a community school.
Anyone else from the group want to chime in on that one?
Yeah, I'd love to just say I actually have the awesome opportunity to do my student teaching for my elementary degree at Talbot. So yeah, when we went and visited, it was just the energy. Like everyone is supporting everyone, everyone is proud of everyone, and everyone is just there. And as a future teacher, it's a lot about looking for the right admin that's going to give you the support that you need to help your students be successful. So to have a school community that everyone outside of teachers all are supporting for the needs of the students.
Jen Janako, I know you had a question. Chris, do we have time for one more question?
Yeah, quickly.
Jen, do you still
Mine's
have?
more of a comment, so I'll be quick. So I just love the way that you all thought was, how can UNE support these community schools? I think that's such a critical question for all of us who work at the university. And then I would just throw it a side note for Morgan. I know you've got a portfolio site. I'm not sure the others. I didn't get a chance to look at each one, but I just wanted to say I'd be interested to see how you integrate your work in through IP into what you've got in your portfolio already that would maybe meet some of those educational standards as well. So I'll be looking forward to seeing that.
I just need to speak on behalf of this group. They were so, when we started, they had no idea what a community school was. And this semester, they got to really engage with some community schools and talk to people at the Department of Ed about community schools. And now I believe that was Kelly on the last slide said next steps. We'll see you all next year because we totally have a phase 2 where we're actually going to do now that they have a really better understanding. Now we're excited to dig in. So
this last presentation is from the Interprofessional Team Immersion, which is a massive telehealth simulation we do online every semester. This team 5, were the supportive sloths, and they're going to share with you their experience caring for a pediatric patient with asthma, meeting with their that patient's parents.
Charlotte is a 6-year-old female diagnosed with allergy-induced asthma at age 4. Since her move, Charlotte has been experiencing exacerbated asthma. Recently, she had a severe exacerbation and was evaluated by multiple care teams and was placed on multiple medications at that time. Ms. Soto was concerned as Charlotte has been falling asleep frequently at school, developed mouth sores, and her face has become rounder. She's worried about how many medications Charlotte is taking, as well as the school's lack of understanding regarding Charlotte's situation. Ms. Soto, who's expecting a child in 6 weeks, has been advised bed rest. To address Charlotte's needs and her family's concerns, we are taking a multidisciplinary approach to her case.
A multidisciplinary team consisting of students from 6 different specialties convened to discuss Charlotte's care. The team participated in 2 separate telehealth appointments divided into 2 20-minute sessions conducted over Zoom. Each session consisted of a pre-brief meeting, telehealth visit with Charlotte's parents and designated team members, a handoff, and a debrief to discuss next steps. The IFTE experience completed with a final debrief with Charlotte's parents to discuss successes and opportunities, as well as a debrief with all IFTE teams and facilitators to discuss the experiences of the group.
Interventions that we came up with for Charlotte included using a spacer for her inhaler, diet modifications to increase her healthy foods, oral symptom treatments such as rinsing her mouth out with water after each use of the inhaler, and holistic approaches such as the Maritime Pint. Some of our key takeaways were the importance of patient-centered approach, recognition of the roles of other team members and their contributions, and the prioritization of communication to understand patient preference and act empathetically as a team.
While this experience proved to be very valuable, it was not without challenges. For example, a visit time of 20 minutes did not provide sufficient time for all of our valuable team members to optimally address all of the concerns brought by Charlotte's family. Additionally, varying schedules could introduce challenges setting additional time to discuss the care plan. Finally, the nature of the Zoom visit led to challenges interpreting body language and introduced technological challenges that could disrupt the flow of communication.
As for our conclusion, overall competencies of telecollaboration, motivational interviewing, and communication skills were key factors in tackling this case. Telecollaboration has a lot of nuances, and it is important to consider ethics heavily when working online. We were able to see firsthand what it is like to have a backup plan if things go wrong, how to troubleshoot the computer, and that there are certain limitations to this form of collaboration. Motivational interviewing was an important component of what we got to learn during this experience. We got to practice using open questions, affirmation, reflective listening, and summarizing it all for the patient. All in all, this was a very valuable experience that allowed us the opportunity to grow and become better future providers.
Excellent. Thank you to that group. I believe it was Hannah, Kimberly, and Sarah. Questions for Hannah, Kimberly, and Sarah about the supportive sloths. Let's see, who is here from that group? Hannah, I see you're here. You're the first name. I apologize. What did that sloth stand for? Could you remind me? I'm assuming that's an acronym.
We were required to make like a group logo as part of the experience.
Gotcha. Gotcha. And did you choose that logo because you felt that it would be child-centered, something that, because you're working with children and parents, is it, or was there just another reason why you chose that logo?
My experience of the team names for the interprofessional team immersion is it's a mix. Some of it is designed to be patient-centered, and some of it is motivational for the team itself to remember what their primary goals are for working together as a team and working with the patient. And they're often animal themed and very cute, but we
I have no problem with it. I was just challenging myself. I'm like, oh shoot, that's an acronym. I'm sure that I couldn't find out. So I don't know if anyone has a question for the group. I can throw one out there if no one does. One of the interesting things that you mentioned that I haven't heard other groups mentioned, because maybe this is the thing we don't want to talk about as much, but we need to, is the challenges. And you talked about the challenges being in finding enough time. I'd love for someone in the group to talk a little bit more about, the hard part of interprofessional collaboration when you're dealing with patients. I don't know if someone wants to talk about that challenge from that group.
This is Kimberly. I can speak to that a little bit. I think one thing that we all kind of recognize, especially with doing this work, was that we all have really, really great things to offer, but 20 minutes is not a lot of time to bring in all of the different aspects that each of our disciplines can bring to the table. So especially with our patient, the parents were talking about all these different challenges with social issues or the medication issues and all the things that they're worried about with school. And to provide all of the aspects from my discipline, which was public health. Hannah was from dentistry. She had really, really great insight. Sarah's from medicine. She had great insight. We had nutrition and like all of these different specialties, occupational therapy, like these were all really, really great areas that we could draw from different solutions to help the parents, but just to pack all of that in such a small amount of time was really challenging.
And was that 20 minutes? Was that kind of what a typical appointment time would be? I mean, how did the constraints of 20 minutes come up?
Oh, that was what we were assigned for the IPD experience, for our telehealth experience.
Got it. And I'm guessing that's probably typical for telehealth, maybe. I don't know. Yeah. Other questions for this group? Thank you for addressing that challenge. I thought that was really interesting.
I was going to ask that same question about telehealth. Just out of curiosity, we're probably at time now, but what are the benefits and the challenges of having a telehealth appointment?
I can talk a little bit about the benefits, just because we talked about the challenges, but one of the benefits was that we all were able to be there and we all were we were all present for it. And so it was easy to switch in between and all to come up with the time that we could all meet together. So I thought that was really a benefit of doing telehealth. And it was probably easier. At one point, Ms. Soto went on bed rest, but she was still able to be at the appointment. So I thought that was helpful.
Thank you. Great presentations today in such a variety of different topics, but with obviously a common theme, because that's why we're all here. So